Hello, everyone. It's great to be here with you during our 29 Days of Heart campaign. I'm Selena Gore, the CEO of Women Heart. We are a national patient-centered organization that provides support, education, and advocacy to women living with or at risk of heart disease. And since it is the middle of February, that means that we are halfway through Heart Month and Black History Month. And at Women Heart, that means that our 29 Days of Heart campaign is also halfway through. In that campaign, we seek to lift up the voices of Black women with heart disease, to shine a spotlight on the health inequities that exist for Black women, and to really provide empowering and motivating information about how to take control of your heart health. And that's for everybody. And so, as part of this campaign, we invite organizations to join us in this effort to add their name and their voice to the campaign and to share messages with their audiences. And you can see the full list of partners on our campaign page, which is at womenheart.org/29 Days of Heart. In addition, we also like to feature some of those partners and go live with them on social media so that they can tell you directly about the organizations and what they're up to. Today, I'm really excited to have Laney Poye with us. She is representing the Preeclampsia Foundation. Laney is their Director of Communications and Engagement, and we are so eager to shine a spotlight on this condition, preeclampsia, which is a pregnancy-related condition, but has huge impact on the future heart health of individuals who are diagnosed with it. In fact, the Preeclampsia Foundation has done such a good job of educating and raising awareness about heart health in general among its constituencies that they earned a Women Heart Wenger Award for Excellence in Patient Advocacy in 2020. So thank you so much, Laney, for being here. Can we start by having you tell us a little bit about the Preeclampsia Foundation and what your mission is?
Yes, thank you, Selena, so much for having us here. We've been proud partners of Women Heart for many years because of the link between pregnancy heart health and long-term cardiovascular disease. So it's really just an important cause for us. The Preeclampsia Foundation began back in 2000 as an empowered patient organization working with clinical experts to help share their experiences and to improve outcomes for those affected by hypertensive disorders of pregnancy. So, our mission has always been to help the affected community by educating, supporting, and engaging them, and helping to improve healthcare practices, and ultimately finding a cure for hypertension in pregnancy. Although our name is Preeclampsia Foundation, we represent women who have chronic hypertension, preeclampsia, HELLP syndrome, eclampsia, all of the spectrum of hypertensive disorders of pregnancy. Preeclampsia is basically a life-threatening disease of pregnancy and the postpartum period, which is characterized by high blood pressure and organ dysfunction. A lot of the time it's diagnosed by high blood pressure readings and protein in the urine, but it can also affect a woman's cardiovascular system, her liver, her kidneys, her neurology. So there's lots of impacts that can really happen because of it. And while there are some risk factors for preeclampsia, like it being your first pregnancy, being overweight or obese, expecting multiples, certain autoimmune diseases, and quite a few other things, ultimately, preeclampsia can affect any woman in any pregnancy, even with no risk factors at all. So it's our platform really to say all women need to be aware of the signs and symptoms as they go into their pregnancies.
Yeah, thank you for that. Now, I know that the Preeclampsia Foundation has been working to shine a spotlight on racial inequities in maternal health outcomes in general. And the truth is that we're in the midst of a maternal health crisis. Black women and Native American women experience higher rates of pregnancy-related death compared to white women. And unfortunately and tragically, these rates are not coming down. I'd love for you to talk about the impact of preeclampsia on those numbers, and what that has to do with hypertension and heart health, not only during pregnancy, but as you suggested, after pregnancy. And then what are some efforts you all are taking on to engage and address the crisis?
Yeah, thank you. And The Preeclampsia Foundation, if you follow us on any of our social channels, you'll know that this is an area that we're super passionate about, and we try wherever possible to really advocate and educate on this issue. So, women of color, particularly Black women and Indigenous women, are 3 to 4 times more likely to develop preeclampsia and also to have worse outcomes, including maternal mortality and morbidity. But what we've recognized at the Preeclampsia Foundation is that there's these dire statistics that surround women of color with their pregnancies. And as a patient-centric organization, we know it can be extremely hard to hear that if you belong in those communities and you're being told all the time, you may die just because you are having a baby. That's a
Yeah.
horrible thing to hear. So, our goal is really to focus on what we can do as patient advocates and as individuals and as a collective to address racism and racial equity at all levels. So, um, it starts at the national level, and the Preeclampsia Foundation is a proud endorser and advocate for focused legislation like the Black Maternal Health Caucus's Momnibus. So, if
Great.
you're not familiar with that, I encourage you to Google it or go check out the Preeclampsia Foundation's advocacy page, because it's a group of legislation that's really centered on how we truly change maternal health and improve outcomes for Black women. We also work systematically by partnering with organizations like Women Heart, like the Association of Black Cardiologists, Dr. Shalon's Maternal Action Project, and other Black led organizations that are working to educate providers about implicit bias in patient care and really change the narrative from a very patient centric method. And
Mhm.
then at the end of the day, we want to make changes by empowering and amplifying individuals, because we know from working with women who have experienced preeclampsia and other maternal health conditions that so often women of color are simply not heard during their pregnancies. Their preferences, their concerns, their questions, whatever that might be. And so within the Preeclampsia Foundation community, we want to make sure that we have women from many diverse backgrounds on our patient advisory council, which is our group that helps to keep the organization really centered on what has happened in pregnancy. And then we have a program called Mama's Voices, which is a coalition of about 25 organizations, not just centered on heart health or preeclampsia, but actually the spectrum of maternal health conditions like placenta accretia and AFE and hemorrhage and the many things that can happen to you in pregnancy, as well as cross-cutting issues like racial disparities, maternal mental health, and advocacy platforms and things like that. And we take patients who have had those types of lived experiences and help them become certified patient family partners. So if you go to mamasvoices.org, you can see a list of our certified patient family partners. And these are real women who have been through a maternal health experience and wanted to jump into quality improvement and make things better for others. So just like with Women Heart, which has always been a big champion for women advocating for themselves and being trained to be ready to speak and share their story and share their experience, we really just thrive on making sure that Black women especially are heard, and that we're able to encourage other women as they start their pregnancy journeys and in the postpartum period to feel comfortable speaking up and knowing that they have an organization behind them that's just ready to speak with them and lift them up.
Absolutely. I love that so much. Lainey, it just dawned on me, we often talk about hypertension as the silent killer, because a lot of people have it without knowing it, without having necessarily symptoms. And the preeclampsia is hypertension during pregnancy, if I understand you correctly. So it's the silent killer during pregnancy, which it really heightens, like, to me, sort of bring all of that together. We have to raise awareness, because probably women right now are pregnant, have preeclampsia, and don't know it.
Yes, absolutely. And I think because there's so many Americans, especially that live with chronic hypertension, we kind of dismiss it a little bit as a health condition. We're like, oh, that's something my grandfather takes medicine for.
Yeah.
But in pregnancy, it can be really, really dangerous, and can lead to premature birth. Obviously, as I mentioned before, complications with the organ,
Yeah.
and even death for the mom or the baby. And that's not to say something to scare patients, but just to recognize that it's a serious condition. And at the end of the day, something like 60% of all deaths from preeclampsia and hypertensive disorders of pregnancy were actually preventable.
Oh,
Where along the way, the system failed those women, and it's a leading cause of maternal mortality and especially morbidity. And even the cases of conditions like peripartum cardiomyopathy and certain cardiac conditions, that are some of the leading causes of maternal mortality, are often complicated by hypertension as well, whether that's chronic hypertension or gestational hypertension.
yeah. I mean, it is really stark, and I have heard that we should think about pregnancy as really the biggest physical stressor on a woman's body. So it's not totally, you know, sort of unreasonable to expect our systems to, to feel overloaded or overwhelmed. At Women Heart, obviously, we share your deep commitment to elevating women's voices and training and empowering women who've had these experiences, these particular diagnoses or conditions like preeclampsia, because then they turn around and they support others who might be walking that same journey through peer support and educational efforts. So it's really an amazing way for our kind of structure with our Women Heart Champions to incorporate and integrate the work that the Preeclampsia Foundation does, to have a positive impact on the lives of others as they try to have a happy, healthy pregnancy. Right? I mean, that's what we all want. I also know that this month the Preeclampsia Foundation launched a program called Take 10 for Preeclampsia Research. I'd love for you to talk a little bit about that.
Yes, so we're extremely excited about this program. The Preeclampsia Foundation has an entity called the Preeclampsia Registry, which is a patient database and biobank that captures preeclampsia experiences. So, women who have experienced any kind of hypertensive disorder of pregnancy can provide information about their pregnancy and their ongoing health updates. So, of course, we know there's a link between preeclampsia and long-term heart disease. So we want to capture that sort of longer data that looks at what outcomes are moms having, long term, even beyond their pregnancy experiences. So the Take 10 for Preeclampsia Research campaign is centered on ensuring that Black moms have the ability to participate in preeclampsia research. And so this program was co-designed alongside a wonderful focus group and a design team, Black-owned design team, that basically asks the question and says, we want to know why women of color and their babies are at greater risk of serious illness from preeclampsia. But the only way that we do that is by having women share their experiences so that we can better track those experiences and equip future moms to help save lives. So the idea of the Take 10 campaign is that it takes about 10 minutes to join the preeclampsia registry, and fill out the initial survey. There's multiple surveys within the registry, but that initial one that just kind of gets you in the door takes about 10 minutes. And so by taking 10 minutes, a Black mom can help know that by sharing her story, she can change someone else's story.
Wow.
And that's a really powerful thing, I think. At the
Absolutely.
end of the day, Black moms matter, and we can't say that loud enough. And they're chronically underrepresented in all research, but
Yeah.
especially in maternal health research.
Yeah. Yeah.
So, at the end of the day, we want to make sure that those experiences are heard, that they're amplified. And we're doing that in partnership with Black led maternal health organizations and some amazing ambassadors across our community that are going to help promote this campaign out and help their sisters and mothers and daughters, cousins, friends, sorors, neighbors, whoever, to participate in preeclampsia research and
That's
make every voice heard.
That's awesome. And can they find that that on your website?
Yes. So if you go to preeclampsia.org/registry, you can find information about the preeclampsia registry and look on our social over the next few weeks, because you're going to start seeing a lot of content that shares about what this campaign entails, and how you can take part in that effort and help to amplify those stories of real women affected by preeclampsia.
I love it. An action item is to get on that registry. So thanks for that. Now, before we wrap up, I wanted to ask if you had any advice for our audience. I'm thinking especially about women who may have experienced preeclampsia or high blood pressure in a previous pregnancy, maybe even 10, 15, 20 years ago. What message would you want her to hear today as it relates to her heart health?
You know, it's really wonderful because there is a growing body of research that is showing us what we need to do for women who are at high risk for cardiovascular disease because of their pregnancy health. And the best step to start is really working with your primary care provider to look at your blood pressure, look at your triglycerides, your cholesterol, your blood sugar, all of those markers that can be done with a simple blood work panel, to kind of give you an assess of your overall health. Once you have that baseline, then you and your primary care provider can work together to, if you are hypertensive, to control that through medicine or lifestyle interventions. There's further research that's proving it's extremely important that if you've had a hypertensive disorder of pregnancy, stay active, eat a heart healthy diet. Just ensure all the things that you can control, because there's nothing you can do about your risk because of your pregnancy experience. But what you can do is make those changes for heart health that are effective to just decrease your risk. And then if something comes back in your blood work, or your primary care provider has trouble pulling down your blood pressure, or you have other cardiovascular things going on, then they're the right person to help refer you to a cardiologist for further follow-up if that is needed. But at the end of the day, just being aware of that link and implementing those lifestyle interventions and making sure you're going to your annual wellness visit is the best first step that any woman can take, whether or not she's at risk for heart disease, but especially if she's at risk for heart disease.
Absolutely. Yeah. And thank goodness, increasingly, there are cardiologists who specialize in women's heart health, which is fantastic. And I know, for many people, access to good care and access to cardiologists is challenging. But if you can, have a look around and see what cardiologists are available to you in your area. Thank you so much, Laney. We invite everyone who's been listening to learn more and to take action, as we just talked about. You can visit the Preeclampsia Foundation's website at preeclampsia.org. Is that right?
That's correct. Yep, perfect.
And then you can also visit womenheart.org/29 Days of Heart to learn more about our campaign this month. And then spend some time on the website. There's a lot of information, really good information about heart disease, but other resources as well to enable you and family members and friends who might need it to access peer support. That's what we're here for. And that's how we can help others to improve their heart health. So thank you, Laney. Thank you, everyone, for joining us. And we'll see you next time.
Thanks, Selena. Bye, everyone.